This presentation is to present some of the policies and procedures for the simulation lab that we'll be using fall semester for our Technical Skills 1 course, and to go over a few of the basics of clinical procedures and some of the steps that we need to take that are common to pretty much any clinical procedure that you'll perform. The objectives for this presentation are to review those policies and procedures, talk about the basic process for educating patients, talk about obtaining informed consent for procedures, and list the common steps necessary to any clinic procedure. One of the things that we need you to do before we start this course is to review the policy and procedure guide that is posted to this particular Canvas module. The whole thing is linked there as a PDF. So we need you to read that from front to back. One of the things that I wanted to point out in the policy and procedure manual is some of the policies surrounding video recording. There is video recording that takes place in the patient examination rooms, not in the classrooms, but in the patient exam rooms, we do this for a couple of reasons. One is that during your patient encounters, we want to ensure that you have the opportunity to watch yourself perform that encounter. And then we also want to make sure that in the event one of us zoned out while grading or missed something that you were doing in there, that we have a recorded a record of that so we can go back and make sure that you get the credit for performing those skills. So in order to do that, we need you to print out, sign, and then upload back into Canvas in this module the policy and procedure photo video agreement. Now when you look at the policy and procedure manual, you'll see that there's one of these agreements at the very end. Just ignore that one. I've recreated it as a standalone PDF and linked it to this module so that you can just print it out and then upload it back in. So if you could do that prior to the deadline, that would be great. And let's move on. So some of the basics, and again, there's more detail in the policy and procedure manual, but we want to make sure that we're treating the mannequins as if they're real patients, which feels a little odd at first, but it's really good practice for interacting with patients. And this even applies to the gowning of the patient and protecting the patient's modesty and all of those things. So let's treat these high fidelity simulators or mannequins as if they're real patients. We want to be professional at all times. This is really important in the way that we're talking to each other and the way that we're using this particular facility. There are other programs that will be present there. Nursing will be there sometimes when we're there, as will the med school. So we want to represent the program well. Please don't use any pens or liquids or anything really on the high fidelity simulators, the mannequins. Their plastic skin can be broken down by various types of solvents, and ink, when it gets on them, is almost impossible to get off, so let's not mark on them. We don't want any phones in the lab. You can have your phone in your pocket as long as it's off, primarily because we don't want any photos or recording, so there won't be any Instagramming of what we're doing in the simulation lab. Wear gloves when it's indicated. So we don't need to wear gloves when we're doing physical exam skills, if we're just doing general heart and lungs and things like that. But particularly next semester when we're doing suturing and those types of things, we want to make sure when we're supposed to be that we're actually wearing gloves, and those are all in the exam rooms for us. Let's not take anything out of the room. If there are pens, pencils, you name it, in the rooms, we need to make sure that those stay in the room when we're done. Anytime we're using sharps, and again, this won't be this semester, but certainly next semester, we want to make sure we pick up all of our sharps and we get them into the sharps container. We want to make sure that we pick up our trash and that we aren't sitting or lying on the beds or trying to have wheelchair races in the hallway. There will be occasion for you to sit and lie on the exam table, certainly when we're practicing our exam skills, but particularly in the beds that are made up where the high fidelity simulators are, we don't want to mess those up at all, so let's not lie in those. No running. We don't want anybody to get hurt. If you do happen to get hurt, there is a first aid kit in room 224 up there in PHS, right by the sim lab. But please let one of the faculty or the simulation center staff know as soon as possible. Don't play with the defibrillator. I'm not even 100% sure it's a real defibrillator, but just in case, let's not find out the hard way. If we happen to use cloth gowns for any reason, make sure they get in the hamper. And then when we're done in the exam rooms, pull out some new table paper and let's throw away our old table paper so it looks nice and neat when we leave. And then as always in the lab, we want to wear closed-toed shoes, even when we're doing EKGs and things like that. It's just good practice to wear closed-toed shoes when you're in the lab for any reason. If there's any deviation from that, certainly I'll let you guys know in class. Okay, so let's talk about some of the basics of clinical procedures. So we're going to talk about informed consent quite a bit in the PA role development course, but just to kind of start you thinking about remembering that obtaining informed consent is the first step to any clinical procedure. So it's our responsibility to know who can and can't give consent, and if we don't obtain consent for a patient, we can actually be charged with battery. So the three criteria for consent are that the patient has to have the capacity to consent. So they have to have the cognitive ability to understand risks, benefits, and alternatives. We have to make sure that the information they're provided is adequate and clear and provided in a language and at a level that they can understand. We don't want to use a lot of jargon. If English is a second language, we want to make sure that we are able to provide information in that patient's original language so that they really truly understand the risks involved. And consent must be voluntary, so it can't be compelled by gifts or by money or threats and so on. And then finally, it must be documented in the patient record. So in most cases, the patient will sign a document giving consent, and then that document will be scanned into the patient's electronic health record. And usually when you're documenting your procedure, there'll be a little button that you click that says consent has been obtained. When we do clinical procedures, we want to observe standard precautions to prevent the transmission of bloodborne pathogens, and this is part of your OSHA training, obviously. Hand washing is our first line of defense against transmitting pathogens, and also the use of your personal protective equipment. So this is your face mask, this is your protective glasses, gloves, gowns, etc. We want to be very careful with needle stick prevention, so we're going to talk quite a bit about this next semester when we do injections and do IV access and suturing and so on. Basically, we don't ever recap needles, we don't reuse needles, needles go straight in the sharps container, so we'll talk about that more next semester. And then environmental management and how we clean up and sterilize areas so that, again, we prevent contamination and transmission of pathogens. So educating the patient, we talked about this on the last slide when we talked about informed consent, but it's really important that prior to doing the procedure that the patient understands exactly why you're doing the procedure, how they're going to need to take care of themselves following the procedure, what the potential side effects or risks are, and what signs and symptoms to look for if we're, for example, asking the patient to monitor a suture site for signs of infection and so on. So what are those signs of infection? What do they look like? So all of those are really important components of educating the patient both before and after the procedure. So the basic overall steps to any clinical procedure, and these are procedures outside of the operating room. Those have a little bit different series of steps that need to occur, quite a bit more involved. But in general, clinical office procedures, we want to educate the patient about the procedure, make sure that they understand it and have made a decision based on their understanding of the information, and then we want to document that consent. You want to assemble everything you need. So the worst thing is to find out you have forgotten something critical and already have sterile gloves on and have to break your sterile field and run out of the room and the patient's nervous. And so we always want to do our best to get everything we could possibly need together and close at hand so that we don't have to scramble. You want to put on your personal protective equipment. That's very important. Everybody generally puts their gloves on when they need to, but we need to think about things like potential body fluids that could get into your eyes and your mouth and so on. So it's really important to wear whatever personal protective equipment best protects you based on the procedure. Then you're going to perform the procedure. We want to explain to the patient what we did. If there were any problems that came up during the procedure, it's very important to talk to the patient about that. And then we want to document all of those things as well. And we'll talk quite a bit about how we document procedures next semester when we start doing some of the more involved procedures. But basically, you explain that you obtained informed consent. You talk about every single step of the procedure you did, from injecting anesthesia and how much to how well the patient tolerated or did not the procedure and how much blood was lost. So again, we'll get to that next semester. Then we want to talk about aftercare and follow-up, and importantly, we want to document that the patient has expressed to us that they understand what the aftercare involves and what the follow-up plan is. And then finally, all of this goes into the patient record, and it needs to be arranged in such a way that anyone coming after you to read this patient's note can get a really good picture of why you did the procedure, how the procedure went, and so on in the event that they have to see this patient in follow-up. So that's about it, just some basics. Please don't forget to read the policy and procedure manual for the simulation lab, to print out, sign, and upload your video and photo consent. And then finally, just so I can make sure everyone has made their way through this module, there's a short quiz in this module as well. Please complete that. I've created a deadline for all of these things that is listed in your module. So we'll see you soon, and I'm excited to start this technical skills course series with you.